I'm Maggie Eisen.
And I'm Jonathan Pyle, and we're with Philadelphia Legal Assistance, a nonprofit legal services organization that provides free representation to low-income Philadelphians with civil legal matters like mortgage foreclosure, family law, and public benefits. And we're seeking funding to ratchet up a demonstration project that employs a unique model of legal service delivery to improve population health. We call it the Medical Legal Community Partnership, or MLCP.
The MLCP puts lawyers and paralegals into community health centers, co-locating them with healthcare providers and social workers. The idea is that when folks come in to get their primary care, they're screened for legal needs, and if they have legal needs, they're led down the hallway to the MLCP to get their legal needs addressed.
So we started our MLCP small scale at a single site in West Philadelphia last fall using law students and volunteer attorneys. We decided to start the project after Maggie, who was a Stoneleigh Emerging Leader Fellow at Health Federation at the time, conducted a feasibility study that made a strong case for MLCP. So we hired her to build it.
And Jonathan helped design the MLCP from the beginning to make it replicable and scalable. He used his background as an attorney and a technology consultant to, I knew I was going to mess this up, to help set up processes and policies to facilitate collaboration and supervision.
Our ultimate goal is to scale the MLCP to 8 health centers around the city using full-time employees and funding from our healthcare partners. But in order to convince the healthcare partners to fund us, we need to show them that we're a good investment. And in order to do that, we need to transform our shoestring operations that we currently have into a robust demonstration project that shows the benefits of MLCP.
Medical Legal Partnership is not only a model of service delivery, it's a national movement. Hundreds of health settings across the country are implementing these medical legal collaborations in order to address the social determinants of health. The movement has been funded largely by foundations who understand the potential and the value of the approach, but we as a movement have not yet really developed a plan for long-term sustainability.
For our healthcare partners to fund us isn't charity, but financial good sense. Here's a common scenario. A doctor is trying to explain to a patient what she needs to do to manage her diabetes, but she keeps bringing up the fact that she's scared of being evicted and of having enough money for food. She doesn't follow the doctor's orders because she can't. And as a result, her health decreases and the insurance company pays more. Doctors can't address the underlying problems that impede treatment, but lawyers can. And if they do, the healthcare services would be more effective and insurance claims would go down.
Currently, patients can get healthcare services and legal services from 2 separate institutions. But for a very large segment of the population we serve, this siloed approach simply just isn't working. Patients usually don't know how to diagnose their own legal services or their own legal issues. And when they do know how to do that, they're often unaware of legal services that exist for them in the community. So to address the social determinants of health, health settings need legal professionals on the team. And this is clearly the direction that healthcare is taking. The Affordable Care Act encourages these team-based approaches that really get at the root causes rather than just the symptoms.
So this team-based approach has real social benefits. However, our healthcare partners aren't going to fund us unless we impact their bottom line. But luckily, there's one service that we provide that does have a direct financial return on investment, and that's appealing Medicaid denials and other insurance denials.
For example, we had a case last fall where a physician referred a patient to us who had had a major operation but had been denied Medicaid coverage for her operation. We represented the patient in the appeal and we won, and we recovered $75,000 in healthcare coverage for the healthcare provider, and then we saved the client from a lifetime of medical debt. So the healthcare provider would not have brought this appeal without us, and the healthcare system would have written off the expense to charity care, which would further diminish their revenues.
So we think that this is the key to making the MLCP model sustainable. If just 5% of our caseload consists of successful Medicaid appeal cases, and the average recovery in each case was $25,000, then our average reimbursement for all of our cases will greatly exceed our costs. So this means that if our healthcare partners were to give back just 20% of the reimbursement that we recover for them, that's sustainable funding.
So our immediate need is funding for a 2-year demonstration project in which we will very carefully measure the financial return on investment. We need $220,000 a year for 2 years to handle cases at the health center and then to work with an expert program evaluator to evaluate our work.
So we invite you to explore with us how the MLCP can change the way that the healthcare sector operates in the future. And we would like to talk to you further about this.
Thank you very much for your attention this evening.